Hello, everyone. Welcome to the very first episode of Yuval's newest podcast, Echoes of Hope. It is an honor to get to share this with you. My name is Jonathan Ogbogu. I am a current Yuval Foundation ambassador. And on this podcast, we're bringing you inspiring stories from the front lines of global health where compassion meets action and hope resonates across continents. From bustling hospitals in sub-Saharan Africa to underserved communities at home, we explore how healthcare advocates, community leaders, and everyday heroes are bridging critical gaps in healthcare delivery. Since 2015, the Yuval Foundation, otherwise known as the United Vessels of Love, has transformed communities through the belief that love and care for all humanity can overcome any obstacle. We're not just treating symptoms, we're building hope one story at a time. This is Echoes of Hope. Let's build healthy communities together. And it is an honor for you all to learn about the United Vessels of Love through its founder, Dr. Faith Adole. So, Faith, feel free to introduce yourself.
Thank you so much, Jonathan. It's an honor to be on today on our first episode of the Echoes of Hope podcast. And hello, everyone. I'm Dr. Faith Adole. I am a board certified nurse practitioner. I'm a global health advocate, a healthcare executive, and I'm the founder and current president of the UL Foundation.
So, Faith, how did the United Vessels of Love Foundation get its start?
Absolutely. So UL started actually back in 2014, before we were officially incorporated in 2015. We started as a small community-driven grassroots initiative in Southern California, where we focused then on addressing healthcare gaps for underserved populations, particularly those experiencing homelessness and food insecurity, doing a lot of health promotion and preventative care. But by 2016, we expanded our reach globally, introducing international medical outreach and other key health initiatives, recognizing the urgent need for sustainable healthcare solutions in low resource settings.
So, it was wonderful learning about where you've all started and where it is now. But I'd now like to know more about you. So, what does leadership mean to you?
Describe myself as a servant leader, definitely. Leadership to me is about serving first, empowering and uplifting others, and really having the courage to keep going, even when things feel overwhelming or unsure or uncertain. For me in this journey, the biggest aha moment for me was that I don't have to know everything at every given time, but I do have to be willing to learn and grow, be a sponge, and ultimately just keep showing up.
Well, that is good to hear because I recognize how you can use these skills in your role as a nurse practitioner, in your role as a nurse executive, and as a leader of a
Absolutely.
nonprofit. So, how have you been able to leverage your expertise in order to bridge the gaps that resource communities have worldwide?
Yeah, definitely. It's all connected. So, my experience as a nurse practitioner and healthcare executive has really provided me with this dual, unique perspective. One grounded in both frontline clinical care and high level systems thinking. So, this has really allowed Yuval to take that holistic approach to global health challenges, in my opinion. As a nurse first, from a clinical standpoint, I've seen firsthand how access to even the most basic healthcare services can be life-changing for individuals and families. I've seen that as a bedside nurse in the hospital and home health and working in global health. They're all the same themes that I've seen. And then from a leadership and policy perspective, I understand that structural barriers perpetuate disparities, right? So this balance of clinical and leadership has helped Yuval craft solutions that are both patient-centered and system-oriented, I would say.
All right. So now that we've talked about Yuval's growth, we've talked about you as a person and as a leader, I like to get into some inspiration, because I can imagine people on social media, people reading the website, people working with you are probably wondering, if Faith is doing this, how can I get involved? How can I pull this off if I want to do this someday? So the question I have for you is, looking at Yuval's growth over the past decade, how has your vision changed, and what is it currently for this organization?
It's a great question, Jonathan. And first, I want to answer that by touching upon one thing. Really, it was my vision to start out with, but the last 10 years, it's really become our vision as one family with Yuval. We're a volunteer-led enterprise, which is amazing, filled with volunteers globally all around the world. And it's a collective mission. And looking ahead for the future, the vision for Yuval is really that Yuval becomes a global model, right? For what's possible when local solutions are combined with sustainable support. I want to see us expand our impact. It would be great to help support the building of more healthcare systems, empowering even more healthcare workers, especially in low resource settings, locally and globally around the world, and then scaling some of our existing programs that we have to replicate them in other underserved communities.
Wow. I found it interesting when you mentioned that you want the United Vistas of Love Foundation to be a global model for what's possible. Um, that is something that is really phenomenal, because starting a project is different from being able to see it to completion and seeing it being replicated and causing a positive difference in the world. So that's truly fantastic. My last question is for anyone who's listening to this podcast and wants to do the work for you do that you do. What advice do you have for someone who just wants to do nonprofit work in community health?
Sure. So my biggest advice, if you're very much interested in community health, volunteering, global health, is yes, start with heart, but don't stop there. And I'll explain what I mean. So passion is powerful, but if you really want to make a difference, you have to do so by creating a structure. If you want real impact, you have to be consistent, and you have to be willing to truly listen to the communities that you want to serve and help. So if you're interested in getting started, whether as a local volunteer or in a leadership capacity, I would say firstly, immerse yourself. Immerse yourself as a volunteer, and it's one of the best ways to begin. It gives you firsthand insights of the realities on ground, and it helps you to understand the needs firsthand, and really serves as a teacher of how you can serve with humility and not just assumption or something that you've read. Because the work isn't just about charity, it's also very much so about partnership. Go in rather asking and not telling. I would leave you with that.
Uh, well, you made a phenomenal point, and uh, it's been wonderful getting to hear your advice for someone who has not only talked the talk but walked the walk in terms of nonprofit work and community health. So, Faith, thank you very much for being available to join us and share your wisdom on this podcast. And as for everyone, thank you very much for listening. Please stay tuned for our next episode on the Echoes of Hope podcast.